If you are worried you have Lyme disease, or just like the outdoors, and want the peace of mind of knowing whether you have Lyme disease or not, there is a new Lyme screening test based on decades of research by Dr. Richard Marconi, a professor at VCU Medical Center. For more information, visit glymedx.com, that's glymedx.com, or email at info@glymedx.com.
Infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert, and welcome to the latest episode of Outbreak News Interviews. Now, health promotion has a key role to play in disease outbreaks and health emergencies by offering bottom-up approaches that actively involve communities, by using local expertise and networks in the delivery of the response. Now, this was written by today's guest, Dr. Laverack, PhD. Dr. Laverack is the author of a new book, a unique book, Health Promotion in Disease Outbreaks and Health Emergencies. Dr. Laverack, welcome to the show, sir.
Thank you for having me.
Now, let's start out with, what is the purpose of your book, and why is this information important to get out to the public health professionals?
The purpose of the book is to clearly show the role that health promotion has as an approach in disease outbreaks and health emergencies by effectively using both bottom-up and top-down approaches. And I think this is important to health professionals because, from my own experience of working in disease outbreaks, this is an area that's often weak within an outbreak response. So I'm hoping this book, which is being written in a very simple way, will be readable to many health professionals in the field.
Now, can you define health promotion? What does that actually mean to the average person?
Yeah, simply put, Robert, health promotion is enabling people to take control or more control over their lives and health, in this case in the context of a disease outbreak. Most countries have a health promotion or a health education department or unit, which is often within the Ministry of Health and therefore is the focal point during an outbreak. The importance really in this context is how we achieve this issue of enabling people to take more control. And it's in a disease outbreak context, it's often done in a top-down way where we largely use communication and messaging and the mass media. To a much lesser extent, we try to work with communities by engaging with them to identify the key issues. And people really don't often play an active role in the outbreak. So this book is trying to address this issue. It's trying to redress how we can accommodate both top-down and bottom-up to be more effective in our work.
Right. Now, as I mentioned in the intro, and as you kind of alluded to just a moment ago, you talk about the importance of bottom-up approaches of management and community involvement. More specifically, why is this such a key component of health promotion in outbreaks?
Well, information by itself is insufficient. This is, what the experiences show us. I guess most notably in the Ebola outbreak. Outbreaks can often involve complex social processes and have a number of, different determinants. And it's really only by working with people, by working with communities, that we can better understand how to address these key issues as they evolve, because outbreaks also change as they progress. And we also obviously want people to use the services and the resources that we provide and the advice that we give. But communities, people, there may be a history of mistrust with authority. So it's really only by working through a bottom-up way that we're able to identify realistic solutions to promote participation, a sense of ownership, and more control. And, we've seen this again and again, for example, through the use of cross-border surveillance with the Ebola outbreak, helping with contact tracing and case management. So there are real benefits to including people in a bottom-up way I would argue, in all outbreaks.
Now, the link between health promotion and public communications is really emphasized in the book in Chapter 3. And it appears to be a big piece of the outbreak response. And, of course, this is 2017. I want to really touch on social media. So, Dr. Laverack, can you talk generally about the importance of communication in an outbreak and the role of social media?
Yeah, communication is very important, and this isn't an either-or case. It's not either top-down or bottom-up. It's both. It's how we use both, and top-down communication strategies are very important. I read somewhere yesterday that there are more mobile phones on the planet than there are people at the moment. So obviously, digital tools and social media are absolutely revolutionizing the way, we increase people's ability to connect and to participate in decision-making more than ever, if it's done in the right way. And we have seen some good examples of using, for example, SMS to address polio in countries such as Somalia, in remote areas, where people have mobile phones, but where access is very limited because of conflict. So at best, communication provides accurate and trusted information so that people can make better informed choices. But the problem is that, in the rush to address an outbreak, communication can be overly used at the expense of proper engagement with communities. And this raises a number of issues. To me, one of the most important is, what is the information that we're giving in our messaging? Sometimes it's quite simple, about using bed nets or hand washing. Other times it's much more complex, and this raises the issue of the role of anthropology versus more rapid, knowledge, attitude and practice, or qualitative methods when we're trying to identify the key messages that we're using.
Okay. Now, basically the latter half of the book, you really go over specific outbreaks and the responses, and which clearly I found the most interesting. And I want to talk about a couple of those chapters and have you really discuss it. Now, you dedicate a whole chapter appropriately to the Ebola outbreak in West Africa. What was the role of health promotion in preventing the spread of the virus?
Yes, I was involved with the Ebola outbreak, and I worked for UNMIA, and UNICEF headed the pillar for social mobilization and community engagement, which is where health promotion would sit. And UNICEF used, C4D, communication for development. And we were able to see across the three countries that there was a slightly nuanced, a different variation of an approach of communication, depending on essentially the agencies that were running the communication. What we found was that the C4D, the communication top-down style of working, was not. It was fairly clear that it wasn't able to change these deep-seated beliefs and practices that were leading to the spread of the Ebola outbreak, such as unsafe burials. And you could see that through the epidemiology. We could see, you could more or less trace where there had been an unsafe burial, because not too long afterwards there was a mini explosion of cases related to that incident. What was missing, and this came later in the outbreak, but what was missing was, this need to engage with people to better understand how we could more effectively address and work with people at a local level to address the Ebola outbreak. And this, in the end, through this bottom-up health promotion approach, community engagement came out in the form of self-management of people that were ill, in the community, providing with care and support, community quarantines turned out to be quite effective. Training, for example, in PPE, personal protective equipment, which at the beginning, particularly with the burial teams, was not being very effectively done. But also, having a better understanding of the cultural appropriateness of how you would remove a body and undertake a burial for a Muslim or a Christian person or somebody of a different belief. Or even when we were working with Ebola care units, engaging with the community so that they took an active part and understood clearly what we were trying to achieve. So it was the advantage, the added value, if you like, of health promotion in this context was going beyond simple, nuanced messaging, which really didn't go far enough with the Ebola outbreak. It came a little bit later, perhaps a little bit too late in some cases. And I think one of the key issues that came out of this whole experience with health promotion and Ebola was that, we quite naively, I think, assumed that the approaches that we were using in a rural context could then be replicated in an urban context. And as the disease migrated from a rural context into the urban areas, it became a very different context. And we couldn't use the same approaches that we're using in a rural area. And this is certainly an area that needs more research and development, because had the Ebola virus disease taken hold seriously in some of these very large slum areas, shantytown areas in countries such as Guinea, then it would have been a very difficult situation to contain. So it did raise issues that we need to, I think, address in the future too.
Now, one of the big concerns these days is what will be the next pandemic. You discuss influenza in the book, specifically avian influenza, which is a concern right now in China. Can you discuss health promotion's role in dealing with avian influenza?
Yeah, in the book, as you say, I devote a chapter to person-to-person transmission, and I talk specifically about avian influenza, cholera, polio, and MERS. I could have picked others, but I spoke to a number of key experts in the field, and they all about what the next pandemic might look like, and they all more or less pointed towards something that looked like avian influenza. I used examples specifically from China and Egypt. A typical package of top-down and bottom-up approaches for health promotion with avian influenza would obviously target high-risk groups such as people working in the poultry industry, people within the general public and health professionals, and be a combination of key messaging using established approaches, for example, like hygiene promotion, raising awareness about risk, how people can better access services, promoting a vaccine if there is an effective vaccine in that particular case, and strongly promoting community action and self-help, which in this case might be around vulnerable people in the community, such as the elderly, but also about, as I was saying, messaging is not enough. There needs to be at a local level, at a family level, at a community level, a dialogue developed about how best to address or prevent spread of influenza within that particular community. If quarantines are the best way forward, or if working in schools is the best way forward, or if you need to close down schools, for example, how you would do that by working, not just going in and doing it, but how you would do that by working with the community so that everybody understood and cooperated in the process. So it's a combination of both top-down and bottom-up.
Mm-hmm. Now, the last type of outbreak I want to discuss is the ones concerning vector-borne diseases. Of course, since we recently experienced the Zika outbreak, what was health promotion role in the Zika outbreak specifically and in vector-borne diseases in general?
Yeah, the Zika was very interesting because I was involved in that too when I was working with WHO, and that disease, it changed. It went from a vector-borne issue, changed over to a person-to-person issue also, and that took a lot of people off guard, because it shows how flexible we have to be when we are working with disease outbreaks. Not just about really properly understanding these complex social processes involved in the disease transmission and management, but also that the disease itself might somehow change over a relatively short period of time. In the book, under vector control, I talk about specifically Zika, Nipah, chikungunya, and yellow fever as examples of how we might work in health promotion. Again, promoting a top-down and bottom-up approach. So using traditional communication or social media, whatever is appropriate in that context to raise awareness. If there is a vaccine, such as with yellow fever, and we've seen very effective health promotion strategies used, for example, in countries such as Côte d'Ivoire, for promoting the use of mass vaccination or mass access to vaccination anyway. It might be more about personal protection. It might be about promoting bed nets, for example. But communities have a real role to play. When I worked and lived in the Pacific, we were very much involved with environmental control, so getting communities mobilized so that they themselves policed their own neighborhood to prevent the breeding of mosquitoes, for example, and also surveillance, community surveillance in terms of movement of people and what is happening in that community. So, community, a bottom-up role can be very strong, and it can very much complement a top-down approach, which is more focused on risk communication or just on pure communication, which is often one-directional for purposes of cost and time saving, such as using the mass media. So I think what we can see from writing this book and looking at this issue in more detail is that there are packages, there are interventions which come together quite naturally, whether we're working on a person-to-person disease spread scenario, or whether we're working with a vector control, and whether or not there is a vaccine or some other method available. And that's what I try to do in the book. I try to bring these packages together so that health professionals who are looking at these particular issues, it may not be the particular disease that they're trying to address may not be in the book, but there will be a very similar disease in the book that they can use, and then use that as a sort of template on how they might themselves think about designing a top-down, bottom-up approach to for control and management.
Dr. Laverack, do you consider your book more of a textbook or just a general reading book, or both?
Yeah, it's been, all the books I've written, I've tried to write them because I myself am a practitioner, first and foremost. Mm-hmm. I spend most of my time in the field working on public health programs. So it's really written with best practice approach in mind, to be as evidence-based as possible, but it's not written in an academic style at all.
Right.
The books, a number of the books I've written, 11 of the books I've written have been translated into different languages, and in order to achieve that, the book has to be written in a very simple English, and format.
Okay, well, one of the more interesting things I found in your book, and something I haven't really thought about a lot, was the issue of false information and rumors. And, during the chaos of an outbreak, false information and rumors can hamper an outbreak response. And this was mostly seen in the Ebola outbreak. Dr. Laverack, can you talk about specific examples, and how do you get something like this under control?
Yes, you're right. It was in the Ebola outbreak, this rumor, unmanaged, could be very disruptive, led to mistrust and reticence to take part in programs, led to community resistance where communities sealed themselves off from outside authorities, and even led to violence, So it's very important to check, to map and to check rumors, and to identify the source and try to counter them, because it's not just about the The outbreak itself, because of rumors, sometimes quite bizarre rumors, we know that the follow-up vaccinations for diseases such as measles were really low because people held a fear. One in Sierra Leone, for example, the rumor that the government was purposefully spreading Ebola through vaccinating children in schools in order that they could get more money from outside agencies. And we saw where schools, the vaccination vehicles would come to a school and the school would be completely empty. People would just desert the school because they were so fearful. We ourselves tried, when I was working with UNMIA, tried to map areas of resistance and protest, which are often based around rumor. And we often found that there was some element of truth in the rumor, and very often that element of truth was linked to some poor professional practice. So, for example, if somebody was removed, a member of the family had been removed because they were suspected of having Ebola, and then that body was never seen again, or no one found out even what happened to that body, which did happen sometimes, that led to a whole range of rumors about body parts and blood being used, by different people. So you can see why people get fearful. You can see why people don't want to cooperate, and then linked to their own deep-seated traditional practices, it becomes very difficult to get people to cooperate and change their behavior. I have to say that I didn't find, during the Ebola outbreak, I didn't find one agency that was managing rumor well. Or even, I think there was one agency, Internews, I think it was called Internews, I use it as an example in the book anyway, somewhere, that was actually trying to map through mobile phones, had a network of people that were informally, logging in when they heard a rumor, and that was then being catalogued. But there wasn't any real analysis, and then, trying to adjust messaging or trying to go to the source, try and counter the rumor. So this is an area I really strongly feel we need to have more research and development in the context of disease outbreak.
Okay, well, let me close with a topic that, again, something I've never put any thought into, and it's the last chapter. It's the post-outbreak response. What actions are part of this post-outbreak response, and how important is it?
Yeah, it's very important. As important, you could argue, as the response to the disease outbreak. In many cases, there are people are seriously affected by the effects of the disease physically. So they may have a disability, maybe a psychosocial issue, it may be a physical problem, it may be that they have some stigma as a result of being infected, as we saw, for example, with Ebola. People can lose their employment, they can lose their home, they can lose their family. It may be that they're not even accepted back into their community or even by their family as a result of being infected. So survivor groups, self-help groups, networks, helping people to rehabilitate, access to services, helping people to reintegrate back into society, into their community, and to get a job and get their lives back, can be really an important part of the work. And health promotion through counseling, particularly through helping to set up networks, self-help groups, can be a really important part of this. The other part where in the sort of during the outbreak, but also in the post-outbreak, where this is important, and I talk about this in the book, is where survivors are recruited as part of, for example, plasma and blood products for research, for developing vaccines, for example. Survivors can often play a very important role in helping others as the outbreak goes on. And this, we can talk about people that are recovering from the disease or have had the disease and survive and go on. It can be in the hundreds and the thousands of people. So they are a real asset and should be looked at, I think, as a real asset, and we should work with them very closely to try and further contain the spread of the disease and to understand how in future we can better manage the disease.
All right, Dr. Laverack, if someone is out there that wants to read your book and find it, where can they find it? I assume it's on Amazon.
It should be on Amazon. Mm-hmm. It's published through Taylor and Francis, which is a big publishing house. Specifically through, the easiest way to get access to the book would be to go through crcpress.com and then just to type in an author search, and that would bring up the book.
Okay, good. Again, the book is Health Promotion in Disease Outbreaks and Health Emergencies by Dr. Glenn Laverack. Thank you, Dr. Laverack, for sharing your time and expertise, and congratulations on this one-of-a-kind public health book.
Thank you very much.
You're welcome.